So watching the little movie clip from the movie On the Edge, I noticed that the doctor had there were multiple things that the group leader or the doctor could have addressed it differently. The first things that I noticed was when Jonathan came in and he directed him to grab a seat. He said something like, "We just got started." And then he said something about, he introduced Jonathan to the group and said to everyone to introduce yourself. But then he didn't allow everyone to speak. He started saying their name, like Toby, Leslie, Nick. And this minimized them, minimize the people that's in the group. I'm not sure why he did that. And it makes them feel, to me, he minimized them like they don't have a voice or they're not important. If I were to do this, I would direct him to take a seat, ask everyone to introduce themselves with guided boundaries. I would probably say something like, please say your name and tell us one thing that you feel is your strength today. So it is clearly defined and on topic. And the next thing when Jonathan picked on Rachel, asking her some personal questions, it was obvious that she was uncomfortable. But the doctor didn't address Jonathan's behavior either. This would have been a great opportunity to use the blocking techniques, by reminding the group members of the purpose of groups and the ground rules or the group rules, the reason why the group is here. So something like, maybe I'll say something like, the reason why we're here is to give each other positive support and to learn about ourselves. Please be respectful to each other. This is not where we pick dates, or so something like that. And the third thing that the doctor could have done differently is when Jonathan challenged him to participate in the group topic, asking the doctor what scares him. And he was fighting it by saying, like, it's not about me. This is not the time. Traditionally, I think in some culture, it is a sign of weakness, to tell your student or your group, the people that you're running group for, um, of your own fears. So, and because this is Irish film, I don't know if culturally that was appropriate, but for us, the current trend would, for me, would be, I would probably say something like, let's pass out the list and see if anyone wants to go first. And then I will also tell the group what scares me. And this is a part, I think this is, and this is part of modeling. So participating in the group topics will probably make them feel normal. And sometimes when a group leader participate, then it makes more group members willing to participate. So it's, be able to be vulnerable, as part of the characteristics. Yep, and those are my three things. Thank you.